Good morning, everyone, and thank you for joining us for United Way of Metro Chicago's fourth conversation in our State of the Social Safety Net series. I'm Kimberly Gunther. I'm the Chief Strategy and Development Officer here at United Way. This series brings together local data, lived expertise, and the voices of trusted community leaders to better understand how policy decisions, funding shifts, and economic conditions are shaping the lives of our neighbors and the strength of our communities. Today's conversation focuses on a critical and urgent issue, the local impacts of the national housing crisis. Across the Chicago region, housing instability is being driven by a combination of rising costs, limited supply, long-standing disinvestment, and policy decisions that continue to put pressure on an already strained system. And when housing becomes unstable or unattainable, the impacts ripple outward, affecting health, education, employment, and neighborhood vitality. At United Way, this issue is core to our mission. Through our partnerships, our investments, and the work of 211 Metro Chicago, we see every day how housing stability underpins nearly every other basic need. Today's conversation is part of United Way's commitment to not just acknowledge these challenges, but to better understand their roots, their local implications, and what it will take across sectors to respond. In addition to this conversation, and in response to what we're seeing through 211 data, United Way of Metro Chicago launched the next phase of our response fund, focused on housing stability and homelessness prevention. This invitation-only effort deployed $250,000 in short-term, data-driven grants to trusted community partners, providing emergency shelter, rent, mortgage, and utility assistance, and eviction prevention where the need is most urgent. While we know philanthropy alone cannot address the full scope of challenges, it is a step forward. For today's conversation, we are grateful to our panelists for sharing their expertise and to all of you for being part of this important dialogue. And now I'd like to welcome Jessica Lucas, United Way of Metro Chicago's Senior Director of Community Impact, who will moderate today's discussion.
Thank you, Kimberly, and good morning, everyone. I'm Jessica Lucas, Senior Director of Community Impact at United Way Metro Chicago, and I'll be moderating today's conversation. Thank you to our panelists for being with us this morning and to everyone who has made time to join us. We know how many demands there are right now, and we appreciate your engagement. As Kimberly mentioned, a key driver of today's discussion is what we are seeing through 211 Metro Chicago, our free 24/7 helpline connecting individuals and families to housing, food, healthcare, utility assistance, and other essential supports. The data is telling a clear story. Over the last year, housing requests increased by more than 50%. Housing is now the largest category of unmet needs, reflecting not only rising demand, but a widening gap between need and available resources. Calls for rental assistance, rapid rehousing, permanent supportive and transitional housing continue to rise sharply. At the same time, we are navigating a shifting federal landscape, and while these policies are national in scope, their impacts are felt most acutely at the local level. Today, we'll explore how historical and structural factors brought us to this moment, how federal policy and funding decisions translate into local impact, and what community-based responses are showing promise, and where gaps remain. Before we begin, a quick housekeeping note. Please submit your questions through the Q&A button at the top of the page or submit in the chat. We'll reserve time toward the end of the conversation for audience questions. With that, let's get started and introduce today's panelists. First, we have Amber Hendley. Amber is a researcher, strategist, and educator focused on advancing wealth creation and long-term stability in Black communities. As a researcher in residence with the Chicago Bungalow Association, she works at the neighborhood level on housing revitalization, home preservation, and building pathways to intergenerational wealth. Carolyn Ross is the president and CEO of All Chicago Making Homelessness History, where she leads systems-level efforts to prevent and end homelessness across the city. Her work brings together public agencies, nonprofit providers, philanthropy, and leaders with lived expertise to drive coordinated and equitable housing solutions. Jung Yoon is the Chief of Policy for Mayor Brandon Johnson, where she leads Chicago's policy agenda with a focus on making the city safer and more affordable. She has spearheaded major housing initiatives, including green social housing, and has advanced tenant protections and policies aimed at preventing displacement across Chicago neighborhoods. With those introductions in mind, we're excited to move into a conversation that connects research, lived experience, and policy. Let's dive into our discussion. Amber, I'd like to start with you. So, Chicago's housing challenges didn't emerge overnight. They are the result of decades of policy decisions, disinvestment, segregation, and inequitable development. From your perspective, how did we arrive at this moment in Chicago's housing landscape? And how do historical patterns related to race, geography, and power continue to shape who is most impacted today?
Good morning, everyone, and thank you for having me here, United Way, and thank you for this question. So Chicago's housing challenges did not emerge overnight, and they are not simply the result of market conditions or individual decisions. They are the result of decades of policy, decisions, institutional practices, and uneven investments that shaped who had access to stability, wealth, safety, and opportunity, and who did not. From my perspective, one of the most important things to understand about Chicago's housing landscape is that housing was never just about housing. It became the organizing structure for access to nearly every other system: education, healthcare, employment, transportation, political power, and even public safety. And because of that, historical patterns related to race, geography, and power continue to shape who is most impacted today. If we go back to the Great Migration, Chicago's Black population grew rapidly as Black families came north seeking safety, opportunity, and economic mobility. But instead of being integrated into the city equitably, Black residents were intentionally confined to limited geographies through racially restrictive covenants, discriminatory lending, violence, exclusionary real estate practices, and zoning policies. What became known as the Black Belt was not simply a naturally occurring neighborhood concentration. It was produced through policy and enforcement. And over time, those boundaries expanded geographically, but segregation itself remained remarkably durable. My timeline research shows that by 1970, Black Chicagoans made up roughly a third of the city's population, but nearly 90% of the Black population lived in just 26 community areas. And that level of concentration matters because geography became a mechanism for distributing opportunity unevenly across the city. Where people were allowed to live determined the quality of schools available to them, the level of public and private investment, access to mortgage credit and insurance, proximity to jobs and transportation, environmental exposure, healthcare access, and ultimately access to wealth building itself. So when we look at current challenges like displacement, appraisal gaps, property tax inequities, vacancy, concentrated poverty, loss of Black homeownership, or uneven redevelopment, we are not looking at isolated issues. We are looking at the long-term consequences of systems that were designed to produce unequal outcomes across geography. One thing I try to emphasize in my work is that segregation was not just residential. Housing patterns shaped every other institution around them. So for example, in education, segregated housing produced segregated schools. Chicago's neighborhood school policies reinforced racial separation by tying school access directly to segregated residential boundaries. Black schools became overcrowded and under-resourced while white schools remained under capacity. During the mid-20th century, instead of integrating schools, the district introduced temporary mobile classrooms known as Willis wagons to keep Black students segregated. And even decades later, school closures disproportionately impacted Black communities already dealing with disinvestment and population instability. In 2013, nearly 50 schools were closed in Chicago and 88% of displaced students were Black. So housing instability and educational inequity have always been interconnected. The same is true in healthcare. Overcrowding, historically Black Chicagoans faced barriers to medical care and were often excluded from hospitals altogether, which is why institutions like Providence Hospital became so important. But health inequities were also deeply tied to housing conditions themselves. Overcrowding, environmental hazards, underinvestment, and geographic isolation all contributed to long-term disparities in chronic illness, life expectancy, trauma access, and overall health outcomes. Even today, many of the neighborhoods that experienced historic redlining and disinvestment continue to experience some of the city's greatest health disparities. And then there is the economic dimension. Chicago has a long history of Black entrepreneurship and institution building, from Bronzeville's Black metropolis to Black-owned banks and businesses that created pathways for economic participation despite exclusion. But those gains were consistently undermined by structural barriers. Black families were often denied conventional mortgages and pushed into exploitative contract sales. Urban renewal projects displaced communities while investment flowed elsewhere. Deindustrialization eliminated stable jobs that many Black families relied upon. And over time, those combined forces made wealth accumulation significantly more difficult across generations. That history is important because we often frame housing primarily through the lens of access, particularly access to home ownership. But one thing I argue in my work is that access alone is not enough if the underlying system remains unequal. The question is not simply whether Black families can enter the housing market. The question is whether the housing system itself is structured to produce equitable outcomes. Because historically, Black families often entered housing systems under unequal conditions, paying more for homes through predatory contracts, receiving less favorable financing, owning homes in neighborhoods intentionally deprived of investment, and facing lower appraisals and greater financial vulnerability, even while participating in the same system. So when we talk about housing gaps and racial wealth gaps today, it is important to understand that it is not just the result of individual decisions, financial or otherwise. It is tied to the structure of the market itself and the unequal conditions under which people were allowed to participate. And I also think we have to acknowledge the role of power in shaping whose communities were protected and whose communities were made vulnerable, because throughout Chicago's history, Black neighborhoods were often sites of extraction without equivalent reinvestment. They were over-policed and under-resourced at the same time. They experienced concentrated public housing, school closures, hospital closures, industrial decline, environmental burdens, and later waves of redevelopment that often did not adequately protect long-term residents. So when we ask who is most impacted today, the answer is not random. The communities experiencing the greatest instability today are often the same communities that were historically segregated, redlined, disinvested in, surveilled, and excluded from equitable wealth building opportunities decades ago. And yet, I think it is important not to frame these communities only through deficit, because alongside this history is also a long history of resilience, organizing, institution building, entrepreneurship, and community care. Black Chicagoans built businesses, hospitals, advocacy organizations, financial institutions, schools, and mutual support systems, even under conditions of exclusion. So for me, understanding how we arrived at this moment is not about assigning blame for the past. It is about understanding that the inequities we see today are structural, cumulative, and interconnected, because once we recognize that these conditions were created through policy and systems, we can also recognize that they can be changed through policy and systems. And I think that it is the real challenge in front of us right now is not simply increasing access to existing systems, but asking whether the systems themselves are capable of producing long-term stability, equity, and well-being for the communities that have historically carried the greatest burden.
Thank you, Amber. Carolyn, building on that history, I want to bring us to the present and talk a little bit about continuums of care. So for our audience who may not be familiar, can you quickly define continuums of care and then talk about what pressures our COCs and local housing providers are facing and what the public may not fully see, particularly as new federal housing legislation is passed?
Absolutely. Thank you, Jessica, and good morning, everybody. And good morning to many of our partners I see who've joined us this morning in this work. So the textbook definition basically is a continuum of care is a regional body that was designed to promote community-wide commitments and work and collaboration to address the issue of homelessness. It was mandated by HUD in 1995 to make sure that funding and services were coordinated, things such as shelter, housing, job training, and other support services. And the point of it was to help get people rehoused quickly and minimizing that trauma. Just for background, there are 461 COCs across the country, with 19 of them being in Illinois, of course, Chicago being a part of that 19, and we are the largest community here in Illinois. We have here locally in our Chicago COC more than 100 membership organizations. It's comprised of individuals and organizations who work in partnership. And our goal is to prevent and end homelessness in the city of Chicago. The COC is responsible for coming together with a plan to coordinate and have a comprehensive approach to the provision of housing services and to make sure that we have the voice of people who have experienced homelessness at the table. All Chicago serves as the lead agency for the homelessness response system here in Chicago. We've been designated by the COC, and I apologize, the continuum of care, if you're not familiar with what COC means, to support this system-wide collaborative effort. Our work is driven by the collective impact model, which is an intentional collaboration to solve very complex problems. And so for us, we have a cadre of experts, I call all of them. We have folks from local governments, state government, from our Lived Experience Commission, our youth advisory boards, local clergy, and different folks who have an interest in doing this work. And we have wonderful partners who have provided the provision of these services to ensure that we are not doing this work in silos, that we're making sure that we're working together. The biggest word in all of this is collaboration. And it's really important that we, with the limited resources that are often there, it's important to streamline that funding, come up with strategic approaches with services that are tailored to meet the needs of those who are facing or experiencing homelessness. There's been a lot of conversation about this. For the last 5 years, we've seen an increasing number of folks entering the system to access and request services. We're proud to be a partner in the 211 system, not only in its initiation, but continuing to help as it feeds folks to the right resources and making sure that they have connections with help that is direly needed. For the continuum of care, there's 3 components that All Chicago's been designated to lead. One, we are the collaborative applicant. So the very long and extensive applications that go to the U.S. Department of Housing and Development on behalf of the system are put together by our staff with input from the community. That's the simplest way I can say it, because we have so many voices around the table. It's really important to make sure that people are not only heard, but their input is included in those plans that we put together. Bringing nonprofits, government, faith-based organizations, and businesses together is not hard. In fact, diversity is really a strength in our system, because the more voices we have, I think it creates strength in our approach to addressing homelessness, and not only making sure that people are educated on what this is. It is not a disease. It is not a crime. It is something that people are experiencing often as a result of something else that has occurred in their lives. And so it's important that we don't just give people a key to their new home. It's really important that we have those support services to ensure that whatever path led them to homelessness or being at risk of, that those issues are addressed. So as a collaborative applicant, we set up meetings with the continuum. We make sure that there are agendas and there's input from the community. And the COC members actually put together the plan that is for our community. We also have a partner in the suburbs of Cook County, which is another COC that we work closely with, because our communities are close and they overlap a bit. The second thing is what we call the front door, which is coordinated entry. That is where we want to try to work to prioritize folks based on their situation that they're bringing to the table, and making sure that there's fair and equitable access to the system. And so we are proud to have that role as well. And then finally, the Homelessness Management Information System, often referred to as HMIS, which is, if you go to our website, not promotional, I promise, allchicago.org, we do actually have a dashboard where, as people enter the system, we keep data that's updated on a weekly basis to show who's entering the system requesting assistance, what do they look like, where have they lived, what's their history a little bit, and making sure that we can adjust them in the system. Over the last 3 years, we have seen a significant increase in the number of people seeking assistance. 5 years ago, we were hovering around anywhere between 12 and 14,000 people actually in the system at once. Today we're closer to 18,000. And so as resources are limited and threaten to be limited even more, there are extreme concerns there. I want to also say that with that HMIS system, we often integrate with different parts of the community in regards to folks who need those data needs. Decisions are made based on data. It's important to understand that, as Amber mentioned, the majority of folks who are entering in the system are African American, people of color, who are seeking this assistance based on other factors, based on the communities that they live in and what they have experienced. And it's also important to know we know that there are more people experiencing homelessness than the 18,000 or so that are in the system. However, those are just the folks who have sought assistance through 211, through our websites, through different sources. However, we're not going to try to report on numbers that we don't have an exact hold on. And so we actually want to make sure acknowledge that we know that there are more people who are couch surfing, people who are living with relatives, but until they come into that system. So when folks call us, we tell them to reach out to 211, whatever their need is, asking for emergency assistance, asking for help finding housing. Those are the paths that they take. It's really important that we do this work to make sure that folks who are trying to access these services, that we help to reduce those barriers that allow insecure populations very much unobstructed, quick access to services. That is very key, because the longer people are facing it, sometimes people just give up hope. And that's one thing that we don't want to be a part of. And so that's my short kind of definition of the continuums and kind of the role that we have in this work. And most certainly the one mantra that we live by: we cannot do this work on our own. It is partnership, collaboration. So thank you.
Thank you, Carolyn. So Jung, building on the history and the system pressures that we've discussed, I'd like to turn to how policy decisions translate into real on-the-ground outcomes for Chicago residents. Can you tell us a little bit more about how the city is addressing the impacts and some of the initiatives that the city has implemented?
Yes, good morning, everyone. Thank you again to United Way for hosting this, and to my brilliant co-panelists here. I'm already learning so much. Yeah, so the building on this history and the system pressures that have already been discussed and laid out, I want to dig into how our policy decisions translate into real on-the-ground outcomes for Chicago residents, because at the end of the day, our work is measured by whether people can afford to stay in their homes, build stability for their families, and see a future for themselves in this city. Chicago is facing the same national housing crisis that is straining cities across the country. Unfortunately, we rank the top out of the top 25 metro regions for rent growth. That is not a stat we're proud of or we want to continue to be the number one at. And so what that requires us is to respond with a multi-pronged, locally driven strategy that directly addresses housing affordability, displacement, and ensure long-term stability. So I'm sure everyone here today understands the scale of the challenge as has been described, or in your own work. Chicago is facing over 120,000 fewer affordable apartments than there are families in need. And around half of renters are cost burdened, spending over 30% of their income on rent and utilities. And many neighborhoods are seeing that the real pressures of rising rents and property values as displacement pressures due to gentrification. So to meet this very complex set of challenges head on, the city's taken a number of bold steps. We've legalized additional dwelling units, or ADUs, to expand gentle density and creating more affordable options in neighborhoods across the city. We've eliminated parking minimums in transit-served locations to reduce development costs, making sure we're building for people and not just cars, and that we can have more housing near jobs and transportation. And we passed a transformative $1.25 billion housing and economic development bond to ensure that we can invest in affordable housing citywide, not just in neighborhoods with strong TIF districts. And so all of these strategies and some more that I'll go into is because we're really looking to reduce our reliance on federal programs alone, reduce our reliance on inequitable TIF funding, and make sure that we are expanding our options for building and affordable development. For decades, the low-income housing tax credit, or LIHTC, has been the primary tool for building affordable housing. And I'm sure folks on this call are well aware, it's an overly complex and increasingly expensive form of financing that is dependent on federal appropriations, which is unlikely to grow and may even face cuts. And so we're really looking for ways to build our own capacity to produce and preserve affordable housing across the city. So one of the most breakthrough ways we're doing this is leveraging public investment through our green social housing model, funded through our $1.25 billion housing and economic development bond. And this model is designed to fundamentally shift how we as a city develop housing. So green social housing is built around three core goals. The first is designed to serve the full spectrum of Chicago residents. Each development will include at least 30% permanently affordable units for households earning up to 60% of the area median income, with a target to also include as many deeply affordable units as well for folks around 30% of AMI. And the mixed income structure of this model allows those rents to remain affordable in perpetuity without ongoing city subsidies. And with the LIHTC model, that affordability is time limited and often requires additional resubsidization to continue or get risk getting converted back to market rate housing. The second main thing that green social housing does is it simplifies an expensive and complex financing that is associated with LIHTC housing development. So we've created a $135 million green social housing revolving fund, and this allows us to replace the need for private equity in a development stack. And so that can bring down construction costs and allows the city through the newly established Chicago Residential Investment Fund, the 501c3 developer, to retain majority ownership during that development. And after construction, when the financing converts to permanent, that money goes back into the revolving fund and we can use those dollars again and again and again. So this is creating a really self-sustaining pipeline of new affordable housing without additional city, state, or federal appropriations. The third thing it does is it builds this sustainable, healthy future. Amber alluded to this earlier, the impacts of redlining, poverty, racism. It also shows up in where we build polluting industries and the cumulative impacts of pollution. And so green social housing is saying, not only are we going to build affordable housing everywhere, but we're going to make sure it's green, it's sustainable, and built to high environmental standards, because we know that improving indoor air quality is just as important as also reducing utility bills by hundreds of dollars a year for tenants. And so this is housing that will support both our people and our planet. And finally, we've embedded tenant governance and strong accessibility requirements to ensure that green social housing meets the needs of renters, especially those whose voice and agency has often been dismissed or ignored. Altogether, this model is expected to increase city-supported, affordable, and mixed-income housing production by up to 50% once it's fully ramped up. This represents a transformational shift in how we can build housing. But as we know, production alone is not enough. We're not going to build our way out of the housing crisis, although building is very important. And we also need to protect residents who are most vulnerable to displacement, again, especially in the neighborhoods that are experiencing rapid change. So one example I'd love to uplift is we recently passed the Jackson Park Housing Pilot Program. This is, a community demand driven by residents in Woodlawn and South Shore who have been facing significant displacement pressures due to the building of the Obama Center. And residents welcome investment, of course, but not at the cost of being pushed out of their own community. Since 2015, the median rents there have increased by 43%. Home values have risen by 130%, and more than 53% of households are rent burdened. The area has also seen some of the highest eviction filing rates in the city and ranks among the top for tenants seeking legal assistance. And so the Jackson Park Housing Pilot is a comprehensive anti-displacement strategy that includes reserving city-owned lots for affordable home ownership and rental development, instituting a right to return preference for residents who have been displaced since 2015. We're working to set up a property tax debt relief grant program to help long-term homeowners stay in their homes, and supporting the rehabilitation of vacant properties with affordability requirements. We've also expanded, excuse me, tenant protections, including updates to the tenant opportunity to purchase if their building is being sold, and an extended fair notice period for those long-term residents so that if they are needing to move, they have an extra runway to find another option. So these tools, both production, preservation, tenant protections, anti-displacement strategies, all of these they're not separate efforts. They are interlocking components of a comprehensive housing strategy for Chicago that ensures residents can stay rooted in their communities while benefiting from new investment. So we're really looking to build out a path that is bold, innovative, but grounded in equity to build more housing, protect the residents who are most at risk, and invest in a sustainable future, all while reducing our reliance on federal funding. So we look forward to continuing this work with our partners in the community, the partners on this call, with our city council and our residents to make sure that every neighborhood in Chicago is one where people can live and can thrive, so we can make Chicago the safest, most affordable big city in the US. Thank you.
Thanks, Jung. So I'd like to open this next question to the full panel. So housing stability is an important foundation for all kinds of well-being, which means that conversely, housing instability can prevent that same wellness. So Amber, you touched on this a little bit in the opening question, but for anyone on the panel, what are the downstream consequences for health systems, schools, employers, neighborhoods when housing instability continues unchecked?
Well, I can just kind of expand on some of the stuff that I said early on. So housing instability is foundational because it is not just about shelter. It is the infrastructure that every other system relies on. So when housing becomes unstable, the consequences don't stay contained. They cascade across health systems, schools, employers, and entire neighborhoods. These systems have never operated independently. They've been shaped by the same underlying forces, the racism, geography, and power. And housing has consistently been one of the primary ways those forces are organized. In health, instability shows up as exposure and vulnerability. So my timeline research shows how segregated and under-resourced housing conditions contributed to higher rates of disease early on, and how those patterns persist today through disparities in life expectancy, chronic illness, and access to care. When housing is unstable, people are more likely to experience stress, environmental hazards, and gaps in care, and the healthcare system ends up responding to conditions that were created outside of it. In education, housing instability directly disrupts learning and opportunity because school systems have historically been tied to neighborhood geography. Segregating housing produced segregated and unequal schools, from overcrowded double shift classrooms to school closures that disproportionately impacted Black students. So when families are moving frequently or being displaced, students lose continuity, relationships, and stability, making it much harder for schools to deliver consistent outcomes. In the economy, instability limits mobility and suppresses wealth building. My work shows how housing discrimination, labor market exclusion, and disinvestment work together to constrain income and wealth over time. So when housing is unstable, it becomes harder to maintain employment, build savings, or invest in long-term opportunities. And importantly, my research challenges the idea that simply increasing access to homeownership solves this, because if the system itself reproduces unequal returns, instability and equity persist. In the justice system, instability contributes to over-surveillance or uneven enforcement. And my timeline research documents how policing strategies have historically been concentrated in the same neighborhoods shaped by segregation and disinvestment as it relates to housing. So when communities are destabilized economically and socially, they are more likely to experience heightened surveillance, which reinforces cycles of harm rather than stability. So at the neighborhood level, the cumulative effect is the erosion of the continuity. So when residents cannot remain rooted, neighborhoods lose long-term relationships, informal support networks, local economic activity, and institutional stability. and that weakens the very conditions needed for communities to thrive. So what ties all of this together is that housing instability is not just a housing issue, it is a systems issue. So if current trends do persist, we're looking at a region where public systems become increasingly reactive instead of preventative. Costs rise across healthcare, education, and justice systems. Workforce instability limits economic growth, and disparities become between neighborhoods become even more entrenched than they already are. And they're terrible as they currently exist. So from my perspective, one of the biggest risks is that we continue to treat these as separate challenges when they are actually connected outcomes of the same system. Because my work consistently shows that we are not just dealing with unstable housing, we are dealing with systems that have been structured in ways that reproduce instability for some and reproduce instability for some and then stability for others.
I'd build on that and just say that, the work that we do, we have a clear understanding that the key solution to ending homelessness is more affordable housing. The rents in this area and across the country have just been escalating over the last couple of years, and that's quite challenging. And I think it's really important when you talk about housing instability, we're not just talking about the financial aspect and people's ability to pay rent. We're also talking about things that affect those financial decisions that they have to make in regards to healthcare, in regards to, different challenges that they face. And so it's, affordable housing when it's available is one of the most effective solutions, and when it's combined with individualized and voluntary supportive services. And I put the emphasis on that because I know we're going to chat about some of the challenges we're facing, and voluntary is not as loud of a word in some of those changes as we'd like to see it. Placing housing at the center of homelessness, as well as expanding programs that focus on equity, and also to include crisis response, things like reentry services for our returning citizens and workforce development. I know people who go to work all the time and work very hard, and the money that they're making is just not enough to make them feel comfortable that their housing is stable. And I think we need to have a good understanding of that. We need to continue our efforts to build those resources to support system-wide work with a specific focus on the application of best practices. And as an example of that, one of the pieces that the continuum and people who work so hard in this space have looked at is the whole issue of housing first. To not have to challenge individuals to tell them that they have to stop taking needed certain medications if they're having challenges with their mental health in order to receive services, or what we've seen recently with the SNAPS program, where people have to go and log in, volunteer or hours, or make sure that they're working a certain amount of hours just to receive a basic need and address that basic need of just being able to eat. And so those are issues that we're paying attention to. And with best practices, when everybody takes the approach from the same perspective, then I think people have a more fair chance to get the services that they need and that they're warranted. You and I have choices, and I think everybody should have those choices. And so taking away the ability for people to choose their housing is something that we're very concerned with. And it's something that we're going to have to continue to focus on. Right now, there are so many rich resources in the Chicago area, and many of them sit around the table. When we talk about housing instability, those voices, we've got the commissioner of the city's public health department, family and support services, the commissioner for the Department of Housing, because quite frankly, with our connection with the city and the partnerships that we have, it's really important for them to hear the needs that are out there and what people are challenged with. And so those are some of the things I just wanted to add to Amber's good, thorough approach to this.
Yeah. Thank you. Thank you for all those insights. So when we combine what you shared today with what we're seeing through 2-in-1 Metro Chicago, where housing has become the most requested yet least met need, it's clear that this crisis is affecting not just individuals, but the strength and stability of our entire region and its safety net. We now have a little bit of time. I'll turn to some questions from the audience. So panelists, please feel free to jump in. So we'd like to start a little conversation about tax sales and its impact on families of color. What would happen if we did away with tax sales? This is where Black families lose years of earned equity and the ability to transfer wealth generationally.
Amber, this sounds like yours.
The term best practices just keeps coming to me because I will say right now, the main thing that I support with Chicago Bungalow Association as the researcher in residence is something called Unblocked Inglewood. And part of what we are doing is reclaiming vacancies, abandoned properties, people who don't care and who are just sitting on this for tax write-offs and so on and so forth. And so in that vein, when I'm thinking about like how do we help Black community reclaim these vacant lots, I love the tax sale because they're not paying their taxes. And I want them to be able to forfeit those properties. So in terms of like best practices, it just has to be a thoughtful way around. Like it does have a purpose. Let's just make sure it's not hurting the wrong people. Let's make sure there's due diligence before we get to this point, or let's make sure that there are certain metrics that are in place and steps before you can purchase a home. You have to prove this, you have to show that. Because again, a lot of these, it's not black and white. So things that can be helpful can also be harmful depending on who's regulating, who's monitoring, and the oversight and the regulation.
Amber, that is actually a great segue to another question that was posed in the chat. So has Chicago explored using a vacancy tax on investment properties potentially owned by foreign or wealthy investors that are leaving the properties vacant? For example, California has been exploring this, and it's been a great way to bring in tax dollars.
I can answer that one. It is definitely something we're looking into. There are, I would say, some kind of pre-steps that the city would need to take in terms of tracking ownership of rentals and of properties that are being left vacant through a registry. What we do have and what we increased in last year's budget was our vacant building fee for people who are leaving, for financial institutions who are leaving those buildings vacant. So we've increased that fee. It's an annual fee that financial institutions owe, and that way we can make sure that that is being returned back into productive use to encourage that to go back towards housing and affordable housing production.
Thank you, Jung. To bring it back up a level, can any of you speak to potential impact of Governor Pritzker's proposed housing plan?
I think, it's important to note, although I'm not as familiar with the specific details of the plan because we're still kind of looking at some things. One thing that has helped us to get through several of the challenges over the last few years in regards to basically starting with the pandemic and the quite frankly the misplacement of new arrivals, folks who were sent here not by choice and needing housing, is that the partnership that we strengthened between the city and the state and just our government partners was really important. Being able to provide rental assistance and being able to help, not avoid undoing the hard work that our partners do in regards to getting people housed. It doesn't take much for people to feel threatened that again, that instability is going to come up. The governor and the mayor have been very supportive of the efforts that are out there in regards to, in the meantime, we have the governor put in place a state homelessness chief that pretty much works among all the 19 CLCs that I mentioned earlier and has provided needed resources, not just from one statewide department, but from many, from Housing Development Authority and Department of Human Services and Health and Family Services, as well as the city. I mean, our biggest partner in this that we just never want to let hands go is with Family and Support Services. They maintain the city shelter system, and that's part of the front door that, feeds folks into the system. And I want to say, it is alarming that the numbers are going up, but, with the governor's plan, the hope with that comes that there are now going to be there's going to be a more positive look at longer term solutions. We got to stop doing this stuff from year to year and figuring out how to get through it and taking a deep breath. And while we're doing that, there's 2 or 3 other emergent issues that come up. We need our decision makers, our legislators, to make decisions based on the input that they're getting from all of our communities. We can't be ignored in this regard. And this is some of the work that we're doing through our advocacy efforts to really try to help them understand this is the issue. And we've been in line for a long time. This is an important time, not just to look at how we're going to get through today, but to look at some more longer term solutions.
Thank you. So go ahead, Jung.
Oh, sure. Just to build off of that, the governor's housing proposal, often referred to as build, honestly mirrors a lot of what we've already done in Chicago, from legalizing ADUs and banning parking minimums to really support that missing middle housing development. And we definitely support like a lot of the components of that. But I will say that building alone is not enough to solve the housing crisis, especially for those in the safety net zone, right? The people who are most at risk of displacement, most at risk of losing their housing. And so what we have been in conversations with the governor's office and our legislatures is really also wanting to ensure that we're pairing that with the housing preservation work and the anti-displacement work. For example, ensuring that we can protect our Northwest Side housing preservation, which has seen substantial loss of Latino populations with the loss of naturally occurring affordable housing. And so policies like that, where we seek to incentivize demolitions or deconversions, where people are taking 3 flats, naturally occurring affordable housing options, and converting those to single family homes that are millions of dollars. We want to continue to protect those policy tools to make sure that we can keep people in their housing and we're not continuing to lose that, while still encouraging that extra density and extra development, bringing down those development costs. And so I think it's a yes and, right? We need to build more, and we need to protect our residents to stay in their homes. And we need to make sure that people are getting the resources they need, whether it's legal aid during an eviction process, so that they have a better chance of staying in their homes. So thank you.
Yeah, thank you.
And I just want to double tap on something that Jim just said. Chicago Bungalow Association is very big on preservation. And so there's always talk about new construction, which is very troubling to our soul. It's great, but there's so much there, the bones that has been here for 100+ years, that will be there if you invest in it. And you, instead of building new construction where we don't know, I mean, a lot of this is planned obsolescence, and some of it is not. Some of it might be more thoughtful, but these buildings are still there. And so if we could invest in those rather than put so much, because there's just so much there. There's just so much there of stock that could be invested in rather than starting from scratch. So I just want to tap on that.
Thanks, Amber. So before we close, I want to end with a question for the full panel. So we often hear people want to help, but have no idea where to start. So what actions, whether advocacy and voice, partnership, or investment, do you believe matter most right now?
I think coming together, and people, I hope they understand that, if they call one of our agency partners and say, hey, I want to volunteer, I'd like to help, for them to please understand, first of all, our overall workforce is underpaid and the resources are limited. And so as they are balancing the need to provide services versus, quite frankly, onboarding and managing volunteers is a challenge, but it's still valued. I don't want to take away from that. I think the other piece is, it starts with the basics. If you know or see someone who's in need, please direct them to those resources by calling 211 or, reaching out to organizations like ours. We'll direct them. So at least they get some education about, one, that the resources that are out there, and two, I think that is the onset of starting to build trust, because some folks are having, have had issues for years, because our systems have not worked together always, and people feel let down, and then they stop trying. I think the other piece is, just to give an example, we have a project called Chicago Rents, where we found the need that we wanted to make sure that landlords had a good understanding of what homelessness was and people facing housing instability. And we want to support our landlords as well. When first landlord comes in and says, I don't want to, rent to these type of people, you already are. This is a good opportunity for you to know that these folks that we're referring to you are giving you, they also come with supports. And, not everybody can afford the rents that are before them. And so rental assistance, I think, is really important. But if people want to get involved, there's lots of things you can contribute to this effort, including, support of the programs and just kind of learning about what the issues are and helping to provide, some contributions to the conversation and planning.
Amber and John?
In terms of getting involved and advocacy, I would really encourage people to get to know your neighbors and organize within your community. Make sure you know who your alder person is, reach out to them, talk to them. I think we often, to Carolyn's point, it's easy to other people, but really we need to invite people in and understand everyone's lived experience so that we can really craft innovative solutions that really meet people where they're at.
And basically what was just shared is like community and collaboration. We believe in block by block development. The smaller, it's more sustainable. People have solutions already that they are bringing to the table and bridging gaps when federal dollars are just going away, or we can't get political participation, or find out what is already happening on the ground, who's already starting to solve those problems for themselves, and just connect, because that's what we found to be the most effective, is people who are already solving their own problems, just talking to one another and bridging gaps.
Thank you. Thank you again to our panelists and for your leadership and honesty today. I know there are so many more questions in the Q&A that we didn't get to, especially specific strategies and programs for specific populations like aging adults, individuals with disabilities, and immigrants. So we do hope to continue these conversations. Today's conversation reinforced what we know to be true. Housing stability is foundational. Without it, our ability to improve health, education, workforce participation, and neighborhood vitality is fundamentally compromised. At United Way, we remain committed to using real-time data from 211 alongside ongoing partnership with community organizations to guide where resources and advocacy are needed most. Going forward, this moment calls for continued coordinated action across philanthropy, government, business, and community. While no single sector can solve the housing crisis alone, together we can reduce harm, strengthen systems, and support our neighbors. Thank you all for joining us today and for continuing to engage in this work. Thanks again.